Clinical evaluation of the medical and psychiatric history of a patient and of their current state is the crucial and essential element of the suicide assessment process. It is important because it enables the identification of risk factors in order to determine the patient's immediate safety and the best setting for treatment, and also to develop diagnosis and treatment strategies. Psychiatric illness is a major contributing factor to suicide risk, with mood disorders, such as major depressive disorder and bipolar disorder, being associated with about 60% of suicides. Psychiatric disorders are diagnosed in more than 90% of completed suicides, and more than 80% of these psychiatric disorders are untreated. They'll see the recognition and treatment of individuals with psychiatric disorders. Specifically, mood disorders are essential components of secondary suicide prevention. In addition, the subjective rating of the severity of depression is one of the most powerful predictors of future suicidal acts. For assessing and managing depression, as well as being aware of suicide risks in psychologically, medically, and neurologically disordered individuals is an important aspect of secondary suicide prevention. Consequently, physicians need to be taught to recognize the association between mental disorders and suicide. Additional information about the individual who may be at risk for suicide, such as medical and psychiatric treatment records and toxicology screenings, should also be incorporated into the assessment. Equally importantly, clinicians and other professionals in a position to offer help should not hesitate to ask patients about suicidal ideation, because while it may seem surprising, patients will often talk frankly about the suicidal thoughts and tendencies. If given the opportunity, one dare you to ask about suicidal ideation may be related to health professionals' discomfort with the topic, lack of time, or lack of skills. This area. Clinicians need to overcome these obstacles to provide appropriate care to their patients. What are the most effective secondary suicide prevention strategies? In recent systematic review of suicide prevention strategies, along with other researchers, found evidence of effectiveness in 5 single-B suicide prevention methods, including pharmacological interventions, psychological interventions, follow-up care, reduced access to lethal means, and responsible media reporting of suicide. Suppressant medications are the most widely used pharmacological interventions in secondary suicide prevention, but studies of their effectiveness in reducing suicide attempts have had mixed results. About adults younger than 25, the effective antidepressant seems to be neutral on suicidal behavior, but it seems to reduce the risk of suicidal behavior in the elderly. Else, the relation between antidepressants have suicide. These verbal studies before this class of drugs can be safely used for secondary prevention of suicide. In terms of psychological interventions, suicidal patients often benefit from therapies that address the repetition of suicidal thoughts and behaviors and other factors commonly associated with suicide. Better psychological and pharmacological treatment of depression and alcoholism also appears to decrease suicide rates. Social factors that should be addressed in follow-up treatment. The availability of willingness of supports within the family. Supported rituals. You should be contacted about the suicide risk, and follow-up arrangements include general practitioners, private psychiatrists, family and friends. Some interventions, however, such as telephone and psychosocial follow-up, if show no difference in suicidal ideation when compared with standard aftercare. Many studies show that suicides by particular methods, for example, firearms, domestic guests, or pesticides, decrease after the introduction of legal restrictions than reduced access to such means. This reduction in suicide rates particularly influential it means of restriction, car lights for the common method of suicide. For example, in the UK, the reduction of carbon monoxide is domestic guests, 1958, and the reduced availability of LG6 since the mid-1990s both decreased UK suicide rates. Finally, many studies have exposed a need for a decrease in reporting of suicide and for responsible reporting. Media blackout. See reporting suicide have coincided with a decrease in suicide rates because reports of suicide in the media tend to glamorize suicide for vulnerable individuals. The internet is also increasing concern with blogs and chat rooms, providing accessible instructions for suicide. For these reasons, guidelines have recently been produced for the responsible reporting of suicide. Despite how increasing knowledge about secondary suicide prevention there are still many gaps in the research, and looking to the future thorough evaluations that appropriate treatment of patients with depressive disorders and other psychiatric illnesses should help to improve the efficacy of secondary prevention of suicide. It is also clear that more research to do approaches for the prevention and treatment of suicidal behavior remains essential. Your search from the Perkins Institute at the University of Sydney claims to have found the diet that boosts FGF21 levels. One of the lead scientists on the study was Samantha Soul and Beard of the Perkins. Welcome to the Health Report. Thank you for having me. So what is this stuff FGF21? I mean, it's almost eye-crossingly complicated from the look of it. Yeah, it seems complicated, but it's actually not. Recently, there's actually been an immense amount of interest and fibroblast growth factor you want, or SPF21, and this hormone has actually recently been called this fountain of youth hormone, which we know can be influenced by diet. And the reason why FGF21 is so interesting is because high levels of this miracle hormone, as it's called, has actually been shown to play a huge role in influencing appetite, improving metabolic health and immunity, and even extending lifespan in mice, or something that sounds so good to be true. Usually too good to be true at this point. There are no adverse effects showing with increased levels of FGF21. In fact, a lot of studies are now being done to investigate FGF21 as a therapeutic target for the treatment of diabetes and cardiovascular disease. Let's just go back some year or so ago. We had Steve Simpson, who's the director of the Perkins Institute, talking about this 25 diet study where they start 25 to study bites in mice to see if you could replicate the life-prolonging effects of a low-calorie diet with extremely low-calorie diets and some animal species, and for all animal species it seems, apart from humans, quiz on improving. It increases life expectancy or lifespan. Is the FGF21 really the heart of this matter? We think it actually could be. Certainly in this study, we've shown that a diet low in protein and high in carbohydrate is the most effective way to increase levels American hormone, and that just died was also associated with several markers of improved metabolic health in mice. So tell us a little bit about this study. Well, what we actually did was performed a really large mouse study, as you said, where we took 858 mice and offered them a range of different diets to see how macronutrients such as proteins, carbohydrates, and fats, as well as total energy, could interact and influence levels of FGF21. And we found exactly that we could use diet to increase the levels of this FGF21 hormone, and a low protein, high carbohydrate diet was the most effective way for increasing this miracle hormone. And what effect, that very hormonal effect, then did the hormone have on these mice? Or you able to separate the two? We were actually able to show that the exact diet that increased FGF21 also improved things like insulin sensitivity, glucose tolerance, blood pressure, and blood lipids, even though the animals were little bit fatter. And how do you know that was anything to whatsoever to do with the FGF21, your so-called critical hormone? And rather than just being the next month, it was raised to. What we did was plotted FGF21 using the geometric framework, which is a nutritional modeling platform that helps us tease apart the role of nutrients and calories. Ruiz. And if you line up all the surfaces, the response surfaces, in this framework with FGF21 and all the metabolic outcomes, you can clearly see that there's a specific area in the nutrient space that coincides with increased levels of FGF21 and several metabolic benefits. And what kind of carbohydrate and what happened about with fans in this study of fat did not appear to have an effect on FGF. Anyone levels seemed to be low protein was the primary driver, and that the highest combination was with a low protein, high carbohydrate diet. So does FGF21 do to the body? And that's a really good question. And that's really the next step of our study. We want to understand how FGF21 signaling works in response to diet to mediate all these beneficial outcomes. Do we know that there are any medications affected at this point? No, it seems that it goes up with starvation, goes up with overfeeding. There's also things that influence it. Appetite of these mice change to the eat more or less for the FGF21 goes up. Well, that's a really good question. See, this is one of the things that we were able to reconcile in our studies. As you mentioned, whole range of literature in previous studies have shown that FGF21 is elevated in many paradoxical conditions such as starvation and obesity, high intake of food and low intake of food, as well as insulin resistance, and an insulin sensitivity. So what is going on here? Using the geometric metric framework, we were actually able to tease apart these findings, showing that reduced protein intake is the primary driver of FGF21. Okay, so what happens in mice does not necessarily happen in humans. How did you know? Makes any difference at all humans? Well, I'm glad you said that. We've actually published work just this year showing that FGF21 levels in humans is also increased by a low protein, high carbohydrate diet, and of course, this is really exciting. Mice can be directly translatable to humans. Is there any evidence at all that, if FGF21 has the same beneficial metabolic effects in humans as it has in mice? Yes, there is definitely evidence to suggest that high FGF21 levels is directly related and associated with several benefits of metabolic health in humans as well. So we should put in the drinking water. Yeah, probably. That seems to be the case. Yes. How would it work? I mean, obviously, hormone like this is probably destroyed the stomach. This is not something that you would give directly to people. I assume in the therapeutic context at the moment, it's difficult to do chronic administration to humans. So what's happening in terms of drug development is trying to develop memetics of FGF21 and analog, so not exactly administering this hormone per se, because it would require chronic injections or chronic administration. So, almost nothing was touted as a breakthrough or a miracle by scientists, turns out to be. So what are your modest expectations? So FGF21 in the humans. Well, in humans, we actually think that FGF21 is extremely promising. We think that at least in humans, we've shown that FGSO treatment for type 2 diabetes. Absolutely. Yes. We've shown that humans seem to respond in the same way as mice. So this could mean that we could tailor our diets in our nutritional guidelines to generate a range of benefits from FGF21. Is it to blunderbuss is 50-year to describing something that says, blunderbuss Robin targeted. You just spraying an effect rather than targeting an effect. If you can do anything with it, it's going to be a very wide set of actions, which you couldn't find hard to control this thing at the moment. Everyone is very interested at FGF21, but no one really knows its mechanism of action. And it seems to be a race at the moment. How does it work? What turns it on? What switches it off? And what can we do to find out more about it? So I thought this point, I think it's a really hot topic and everyone's racing to find out the answer. I do hope you'll be first. Hopefully.